Hi guys, welcome back to the channel. So I'm going to talk about opioids today, as I promised on a previous video that I would cover this topic. Mainly I'm going to be talking about opioids for chronic pain and a little bit about how they work and why sometimes they aren't always helpful in the long term. So first of all, I'm going to mention a little bit about what an opioid is. Well, opioids are a derivative of the drug morphine and they come from the opium poppy. There are different strengths of opioid medications that range from weak opioids, such as your codeines, all the way through to your stronger opioids, such as morphine, fentanyl patches, and so on. At the right top end of the scale in terms of opioid strength, you also have street drugs like heroin. So all of these drugs act the same with the body, and what they do is they bind to opioid receptors. Now, depending on whether that is a weak drug, such as codeine, will mean that it will bind to less than 50% of the opioid receptors within the body. If it's a higher strength opioid, or known as a strong opioid, it will mean that it binds to over 50% of these opioid receptors. So in essence, all of these drugs that come under the umbrella term opioids all have the same effect on the body. Opioids work by hyperpolarizing nerve cells. So basically what that means is the opioids bind to certain receptors depending on the strength and the opioid itself. And what that means is that the action potential or the charge can't cross the synapse, which is the gap between two nerves, and it stops the signal from flowing up the nervous system. This is why it can be challenging to come off these medications as well, because the opioids are binding to these receptors, and suddenly when we take the opioid away completely, it just lets those messages flood on through and can create an increased pain response. So that's why it's really important to wean down or reduce these medications very gradually so we don't get that effect or as significant as an effect. Often what we see is that people who have been on opioids for a long time have been on different opioids over the months or over the years. So they may start off on something slightly weaker, like a codeine, which may work for a while and then stops working. And then they're on something stronger, like perhaps a tramadol, which works for a while, stops working. And then they can be on kind of oral or liquid morphine, and then eventually the patches. And what we see there is people just building up and actually going through the different strengths of opioids because they have a short lasting effect on pain, which then means that we have to go back and get something stronger to help with the pain, which helps for a little while and then stops working and we go back. And this is how we can quickly end up on the medication treadmill that I've talked about previously. So it's really important to know what opioids were made for. If we look back historically, opioids are actually made for acute pain. So that's a pain that lasts for less than a 3-month period. Chronic pain is anything that lasts for longer than a 3-month period. Acute pain is less than 3 months, and opioids are made for acute pain. Included in the acute pain is scenarios after operations. So after an operation, people may be prescribed opioids to help with the pain until the pain settles down, and then they can discontinue those opioids. But over the years, what's actually happened is opioids have been prescribed more and more for chronic pain. And when we're looking at the evidence, there's actually no evidence to support the use of opioids for any pain that lasts for longer than a 3-month period, because these medications were designed to be used for acute pain, which lasts for less than 3 months. And that's why often we see that the longer that someone's been taking these medications for, the less effective they become over time. Another example of when an opioid might be used is end-of-life care as well, and that's mainly to keep the person comfortable during their their last few days or last few months. And when we're actually looking at studies for chronic pain, what we can see is actually not many studies last for longer than a 3-month period. So we may see studies that show that opioids help with pain, and they absolutely can do with acute pain. But because the studies don't last for longer than a 3-month period, we don't see the longer term effects of opioids. And in practice, what we see is that these medications just aren't helpful for chronic pain or persistent pain in the long term. Now, even when these medications do help with pain, initially they can give between a 15 and 30% pain reduction. But what happens is that higher strengths of opioids are needed to maintain that level of pain relief. And with increasing doses or higher strength opioids, we also have the increasing risk of side effects and long-term risks as well. Now, side effects can include a range of things such as nausea, constipation, itchiness, drowsiness, euphoria. cough suppression, urinary symptoms such as retention, and also respiratory distress. So it can affect our breathing as well. The longer term risks of opioids are things such as tolerance, where our body becomes tolerant to the medication and it doesn't have an effect anymore. And even on higher doses, we can also reach the risk of addiction. Now, because all of these medications are a derivative of morphine, we can actually calculate the morphine equivalent daily dose of these medications. When we're doing that, it's really important to know what figures actually mean that you are at risk of addiction. So with a morphine equivalent daily dose, anything above 120 milligrams of morphine daily, you are at a significant risk of addiction. The maximum daily recommended dose of any of these medications is 100 milligrams morphine equivalent dose daily. Okay, so anything above that is higher than the recommended daily dose. And even 100 milligrams is quite a high level because, as we said earlier, if you're on those medications, even at 100 milligrams, and they stop working or the effectiveness dampens down, then if we're put on something stronger, that easily pushes us over the 120 milligrams a day equivalent of morphine. Now, this is why medications such as morphine are often not the answer for chronic pain. Because what happens is the longer we take them, there is less benefit and more risks. And often the side effects and the risks quickly outweigh the benefits that people may be getting from these medications. Now, what can be really hard as well is then actually weaning off these medications, because when people have been on opioids for a period of time, we can't just stop taking that medication. That's because the body expects there to be that level of drug coming into the body. So if we stopped it dead, we'd be getting quite harsh withdrawal symptoms such as nausea, shakiness, sweating, etc. And what we don't want to do is stop medications dead, because that will obviously bring on these symptoms. So it's really, really key, if you are taking any opioids, is obviously to consult your GP or your pain professional for advice on reducing medications if that's something that you're thinking about. I'd always get in contact with the professional and make sure you've got the support in place when you're going through a reduction, because it can be tough. You can have periods of slightly increased pain when you're reducing these medications, but you can also have these withdrawal symptoms that are happening as well. So it's absolutely key to get the information and advice on gradually weaning off these medications, so that you aren't having these symptoms that are coming on. Another long-term risk that we see in clinic quite often is opioid-induced hyperalgesia. Now, I know that's a big word, but really that's just a posh way of saying that these medications are actually giving more pain rather than actually helping the pain. And that's just because it increases the sensitivity of the nerves to certain stimuli. So for example, it may increase the sensitivity to mechanical pressure or temperature. So again, things that weren't previously painful become more painful because of the opioids in the system, just increasing the sensitivity of the nervous system. Medications are a very, very small part of the overall pain management picture, and there are lots of other things that we can do to help manage pain. These other things that we do to manage pain, and some strategies that I've already spoken about on this YouTube channel, such as pacing, activity management, managing flare-ups, and so on, are more helpful in the long term, and they don't have the side effects that come with things like opioid medications. So they're a better way at managing pain in the long term, and I mean that we're not going to have this situation of decreased benefits with increased risks of side effects and so on. So if you have only been offered medication such as opioids to manage your pain in the past, I would really encourage you to have a discussion with your health professional about the other options that are out there, such as pain management services or pain management programs, which can help you develop alternative strategies to manage your pain. So guys, a quick tour on opioids. I'm sure there may be lots of questions that you have after watching this video. So please pop a comment below and I will get back to any questions that you do have. If you haven't already, please subscribe to my channel and click the like button below. Please share this with anyone who may be taking opioid medications, because they might find it helpful and can use it as a discussion point with their health professional about maybe weaning down the opioids or discovering other options to manage their pain. It is a big thing that's going on at the moment. There's a lot of press around this, especially in the US, around kind of the opioid crisis there. It's very similar here in the UK as well. It probably doesn't get as much press as it does in the US, but it is very much an issue here as well. So we want to stop the overprescription of these opioids. So spreading the word by sharing this video is going to be really, really helpful. Thanks for watching. Take care, and I'll see you on the next video.